So my name is Aseel Walker, and I'm the Senior Project Management Specialist. I'm originally an international medical graduate and board-certified anesthesiologist. I worked as anesthesiologist in Iraq, Jordan, Dubai before I came to the United States, and I started exploring the clinical research field. So I started with oncology clinical trials, very complicated. I worked there for 5 years. I gained my experience in research before I joined the Integrated Anesthesia Associate to have my dream job of combination of anesthesiology and research together. So in this job, my role is to provide the research support to the clinical staff. I make sure that they have the availability of resources to conduct their studies in accordance to the good clinical practice, which includes ethics, beneficence, compliance, and confidentiality. I also create the research guidelines, and these guidelines help the research staff to operate their studies in a way like consistent and organized manner, and demonstrate the adherence to federal regulations and institutional guidance. So some of these guidelines, like how to build the regulatory binder for the study, how to have the delegation of authority log, and simply just how to start in research, what training you need, city training or disclosure of conflict of interest. So these guidelines, basically, they help all the research staff to do their studies on good clinical practice. Also, we stressed on communication. So we established what we call it the research huddle. It's a brief biweekly meeting where the PIs are, or the principal investigators are, mandatory to attend, and it's open to all research staff to attend. And in these meetings, the purpose of these meetings, the investigators or principal investigators can have the proper oversight of their studies. They can discuss the progress of development, and they can solve any issues. It's an open discussion, and everybody participates in these meetings. Same with the monthly PI meetings. It's like specific to each study.
How do you educate others in research?
Another way to increase research awareness and among research staff is continuous educational training. So we delivered 2 sessions of 4 hours each to the residents in anesthesiology residency program about the essentials of clinical trials. Also, we delivered the clinical introduction to clinical trials for fellows in regional anesthesia fellowship program. We also have the ground round update in anesthesia, which was delivered to all anesthesiologists in anesthesia department. So it's update about all these studies we are doing, and this is like to show that people, they have open opportunity to come and do studies and share their ideas, and they will have the full support and resources to do that.
Could you describe what the research is like at IAA?
So we started with doing investigator-initiated retrospective observational or interventional retrospective studies, and then we expanded to conduct more complicated prospective clinical trials. We also have systematic review of clinical trials, randomized clinical trials. We have quality projects. We are a site or part of some studies from Memorial Sloan Kettering Center in New York. And also we are all excited to have recently to start a process of a new investigational device trial. All these trials are a great opportunity for everyone involved. So we have about 20 studies. 17 of them or 12 of them are more related to regional blocks, regional anesthesia. So they are a great opportunity for the fellows. And imagine if you finish 1 year of fellowship program and you have your name as an author for on several published articles. Wouldn't this be like great?
Describe the IAA Research Team.
Our research team basically consists of the clinical team, the investigators who are the attending anesthesiologists, and the other clinical investigators or sub-investigators who are the fellows, the residents in anesthesiology residency program, UConn medical students who show interest in research. And also we have volunteers who can be graduates, undergraduates, or medical students from different medical schools other than UConn, from USA or even from all over the world. And we have high school kids who are looking to be involved in clinical research, which will help them to get medical student, medical school position, or medical student who wants to get into residency program. So this is the clinical team. And also we have the other part, which is the support team, which includes the research coordinators, we have statisticians, we have scientists, we have data management staff, and we are in process of hiring a medical director to write the manuscripts for all published articles. And the other part of our team is the support staff, which includes the research coordinators, the statisticians, the scientists, and we have data management staffs for pulling data from EPIC. Also, we are looking to hire a medical writer for writing the manuscripts and grants. So we are all excited for that. The benefit of having a mixed model of clinical efficiency is to have a great teaching opportunity or environment for people from different clinical background to work together and share their knowledge and experience. And also it provides a significant value for their career development and growth. Let's say, as I said, like for medical student to get into residency program, or even like a fellow to get into a new career, a new hospital job. So it's a good opportunity to share and work together and get the benefit of.
Why does IAA conduct research?
Clinical trials can enhance health and can detect, diagnose, or reduce the chance of anesthesia-related complication or disability. It can, for instance, it can give the insight or the answer about the safety and effectiveness of a new anesthetic drug, or a new regional block, or any anesthesia-related procedure. So in modern clinical practice, clinical trial is complementary to professional success. It will basically tell the researcher if what does or doesn't work, and this will contribute to a high quality of healthcare and will lead to health improvement, and also improve the cost effectiveness. Something unique about anesthesiology studies, because of the nature of the anesthesiology specialty itself, it is delivering anesthesia to other surgical specialty. So most of anesthesiology studies are collaborative studies with other surgical specialties. So we have a study, for example, TAP-LIP study. It is providing regional block, TAP block for colorectal study, for colorectal surgical patients. And or the other study, we have the eye block quality and safety for eye surgery patients. These collaborative studies allow health workers from different professional backgrounds to work together and provide the highest evidence-based quality of care to our community.
How has research at IAA grown since you joined?
It's a great growing, it's very quick. And we started from like very few studies in early development into like many 20 studies, and in different, we have like few of them ready to be published. We have complicated study already like in startup process. We have like 2 studies awarded grants from medical staff reward. So it's so I think this is a great achievements for a 1 year time period.